going to look at the Executive MBA Health program, which starts in September 2023. Our MBA Health program starts in September 2022, and the deadline for that is the 30th of June. Let me just get rid of that. Okay. Let's minimize this. So our general feeling at UCL is that health is wealth. So if you're healthy, you're able to work, you're able to be economically productive. And health also is a major sector in the economy. So it represents a very large part of GDP in many countries. So it also provides considerable employability in the healthcare sector. So just to give us a little, or you would give a little bit of background about University College London, it's almost 200 years old. It's a research intensive university. It's one of the top universities in the world, and certainly one of the most rounded leading universities in London. So of course, we not only have STEM disciplines, science, technology, engineering, maths, medicine, but we also have philosophers, we have anthropologists, we have historians, psychologists, languages as well. So it's a very rich university in terms of interdisciplinarity. So it's very interesting that we were one of the first universities in the UK, the first university in England to admit women students and non-Church of England students on equal terms as men. And our mission is to reimagine global healthcare management. So most of the research, the majority of the research at University College London is linked to healthcare, at least 60–70% of it. And a couple of weeks ago, we were ranked top in the Research Excellence Framework 2021, which is a census that happens every 6 or 7 years, looking at departments and research quality in the UK. And certainly we were top for medicine, health and life sciences, and for economics, and no doubt other subjects. So really, we're very focused on unraveling the huge healthcare challenges in the world, in different healthcare systems, from business perspectives. So at the intersection of health and management and business education. And we very much see aligned to the United Nations Sustainable Development Goal 3, that healthcare management, the purpose is for public good, to improve healthcare outcomes for everyone at all ages. So I guess the question is, why would you study for a specific MBA in healthcare management? Why would you study for an MBA that's an executive MBA? Why not just a general MBA, not specifically related to health? So Kim Clark, who was the former dean of Harvard Business School, made this comment: medicine and business have long been intertwined, but today, with the extraordinary promise of emerging medical technologies, sweeping change in healthcare delivery, and the push to control the costs of medication, the need for leaders firmly grounded in both fields has never been greater. So clearly, as we've seen in the COVID pandemic, it's not just enough for very clever scientists, physicians, and others to invent vaccines. We also need very capable people who are able to raise finance, who are able to get changes through at policy level in the civil service, through government, and to combine what Sir Patrick Vallance did in the UK. He was head of the medical school at University College London. He was also on the board of Glaxo, and now he's in government. But he drove through the vaccine program in the UK, thanks to his ability to speak the language of the civil service, to speak with private equity funders, to speak with the public on national TV, and to get things moving. So we're looking for people with the EMBA who can actually, operate at boardroom level in the C-suite, as well as speak multiple languages of policymakers, academics, practitioners, management consulting, and so on, and are aiming to work in the boardroom and with people in the boardroom, hence the executive before the MBA. So the healthcare sector is extremely complex, which is why specializing in an EMBA in health, if you want to stay in this sector or move into this sector, is a fantastic offering. If you look at some other programs, we were looking at a few this morning in the US, they're like, okay, this is about healthcare, but actually you do a general MBA, and then we throw in a few odd courses that you can do in the medical school, public health, and so on. For us at UCL, GBSH, the DNA is business and health. So most of the articles you read, most of the academics and practitioners you see, and the assessments, the case studies are related to health and business. So it's absolutely integral into the studies. And clearly it's a hugely diverse sector, which is why a cross-disciplinary, interdisciplinary, transdisciplinary approach is very important. And the new design of the UCL East campus is very much physically designed for us to interact with engineers, to interact with creative social scientists, to have a very different overview from just one clinical medical school perspective that some people might have gained in the undergrad studies. So it's about exposing candidates who come on the program to a diverse range of perspectives from clinicians, policymakers, private equity firms, management consulting perspectives, and to give you the opportunity to understand what leadership opportunities there are out there in health and social care, and that you may have at some point in your career's portfolio of interests. And you can speak with management consultants, perhaps if you're in acute medicine and not been exposed to these kind of people before. And very importantly, primary care clearly matters. So we'll be looking at GP practices as businesses in themselves. And very much the difference between an MBA and an MSc is that we're very much focused on your career development. So from the point when we have an interview with you for the program, from inductions, during our conversations with you, we're very much focused on how you're developing as a person and how you're developing as a professional in terms of your career. So I have 5 degrees. I completed 4 of them when I was working full-time, and 2 of them online. So I know it can be a real struggle to work full-time, have kids, travel, be very busy with your day job. But actually the beauty of doing an EMBA online while you're actually earning and learning is that often in your assignments, you can reflect on what you're doing in your day job, and you can really put into practice the theory practice gap, and make sense and give kind of really free consulting to your employers. So we would expect when you graduate to be working somewhere in the healthcare ecosystem. We would present you with lots of different networking opportunities, not only within the peer group, with our executives in residence and academics, for you to consider opportunities in different parts of the healthcare ecosystem, different parts of the world. And if you're going to lead others, it's very important that you're capable of leading yourselves. So developing your self-confidence, your humility, your own gremlins and areas for development, and making sure you're a reflective practitioner throughout your career and an evidence-based insider researcher are the kind of meta skills we want to develop, as well as obviously how to write a strategic plan, implement and manage other people. So on the current MBA program, we have quite a few medics, dentists, nurses, psychiatrists, GPs, but we also have people with social science backgrounds, people who are lawyers, marketeers, PhD perhaps in biomedicine, other disciplines that really enrich the cohort. And the commonality amongst all these students on our MBA program is that they want to make a difference. So they may be in a healthcare system and they want to change it somehow. And they realize they have to do that by engaging in policy, engaging with key stakeholders. And even if they're entrepreneurs in digital innovation, they need to develop skills in gaining partnerships and trust in the healthcare sector. Excuse me. So is it worth it, all this time and effort and expense and sacrifice to gain an EMBA? So my own experience was I first actually did a specialist master's at one point, and then later I did an MBA. So for me, it was fantastic. I think people do MBAs when they're a little bit dissatisfied with their current jobs. They know things could be better in their organizations. And they do an MBA because they want to learn these theoretical frameworks and change their mindsets from different perspectives, as well as earning at the same time. And very importantly, master's level study means that you develop as a critical thinker. So you question sources of evidence. You enhance your technical analytical skills, but also the soft skills like negotiation, dealing with emotions, moral intelligence. How do you present yourselves in public? How do you use social media? So how essentially do you make sure you're legitimate and credible and that people trust you, and you can't be a leader without followers? So how do you develop followership in yourself and in others? So typically we're looking for mid-career individuals. You've had at least 5 years experience. You want to kind of reboot, renew your approach to your working lives. And you also want to be in a top branded university, because our brand and your brand are very important for your CVs. So we are 8th in the world as a university. We're, as I said, first for research in many disciplines. And unlike some very specialized universities, we are a fully comprehensive university. So you will meet philosophers, historians, anthropologists, people from other non-clinical backgrounds, which I think is very important for your learning. Okay. When you graduate, we would hope these kind of characteristics help you get to your next stage in your careers. So you would certainly understand different healthcare systems in different parts of the world. We have Mark Britnell, who's a senior partner at KPMG. He's written several books. He writes about healthcare workforces, and he's got a fascinating book where he looks at systems all over the world. And he has this list of what would be almost the perfect healthcare system. So maybe you'd go to Norway for this, you'd go to France for that, you might go to the UK for something else, and he picks out the best bits in different healthcare systems. You would, in comparison, in competition with people who just have an MBA, if you were going for a job in the health sector, you would have that great advantage of having an MBA, EMBA Health. You'd have access to cutting edge leading academics and practitioners at UCL. So for example, we have the CEO, Dave Probert of UCL NHS Foundation Trust, who runs 5 hospitals. And he would know you, you would know him, you'd have his email, his phone number, and these kind of mentors who really are making a difference currently in the sector. So at the moment, we've got 30 executives in residence, and you would have access to these people who can help to mentor you and give you career support during the MBA and beyond. We have a recruitment agency, a special career coach working with you. and 40,000 students pass through UCL every year. So as one of those graduates, you would be part of that huge alumni network. And also there's reductions for any executive education programs after you graduate you'd like to participate in. So our success and your success are very much intertwined, which is why, you know, you come to us for 2 years, but we certainly want to keep in touch with you beyond that. So the kind of student we're attracting, as I said, mid-career, we expect you to have a good academic or clinical background with relevant work experience in management or in healthcare or both. Your mindset, your attitude is that you're ambitious and determined. You do want to stay in healthcare management, maybe pharmaceuticals, biotech, a consultancy role. You do want to move to the next level in your career. You want to gain social capital, so connections around the world with people who can help you. And perhaps you may already be working in the National Health Service. So the Messenger review this week on enhancing leadership and management in healthcare is very relevant to what we do. Some people are looking for a career change. So we have 2 projects on consulting skills. So healthcare consultancy is perhaps one option you might not have considered. Clearly, there are other options in private sector organizations like Bupa or NGOs like the World Health Organization. Big pharma, clearly. You might want to start your own business. But wherever you are, you do need to know about legislation and policy, but some people want to work in government as well. One person we've hired who's coming on our program this September wants eventually to be Minister of Health in his country. You may also want to go into academia in teaching and research. So there's lots of options that we would expose you to on this program. Okay, so the next slide is looking at the actual content of the program. So we've designed it and we're going to deliver it to give you exposure to different parts of health and healthcare management, public, private, not-for-profit, NGOs, charities, and so on. We're looking to develop the next generation of exceptional leaders. There seems to be a leadership deficit, certainly in the UK. And we want to develop not only your knowledge of healthcare, but your business acumen. So when you are dealing with investors, you're trying to negotiate contracts, you do have business savvy. And as I said earlier, healthcare expenditure is a significant part of gross domestic product in most nations. It's more than 10%. In the US, it's probably double that. So in terms of your own careers, if you stick with the sector, it's likely you're going to be employable for a long time. And then in terms of the practicalities, the program starts September 2023. It's part-time for 2 months, online mainly, but each year of those 2 years, there is 1 residential week. So during the first year, there's a residential week in London. And then the second year, there's a residential week in USA. And at the moment, we're looking at Boston and possibly Atlanta. And the tuition is £45,000 for the EMBA. And as someone has already asked me in the Q&A in the chat, what about scholarships? So there are also scholarships available. And there is one currently, full scholarship offered by Roche for a UK resident student. But there are several other scholarships where you can build up multiple scholarships. There's also UCL scholarships. And clearly in different countries like India, there's a Chevening scholarship and government funding as well. So I'll talk about that later. There's also an event this month on scholarships run by the director of the Global Business School for Health. So clearly we have people from very different sectors. So we have some induction activities that help really get people up to speed. So we have various online primer courses. For example, if you've never studied economics, accounting, finance, you might like to work on those courses. There's a global health documentary global healthcare systems documentary that Laura Colton and Mark Britnell have made that will be very interesting for you to watch and interact with. We've also got various study skills and time management and other courses that you might like to refresh yourselves with. It's very important that we develop you personally and professionally, and also your team leadership capabilities. So we use a whole variety of personality questionnaires throughout the year and 360-degree team feedback. So you get feedback from your colleagues of how you're performing, areas of strength, areas to develop. And also kind of self-assessment that you're able to reflect on your impact on others and how you need to develop. So the actual modules themselves, we have 4 30-credit modules. So you will kick off with strategy, people, and marketing. That's the focus for one assessment. Then you move on to finance, economics, and data. The third one is executive leadership. And the 4th teaching block is contemporary topics in health and healthcare. And at the end of each of these blocks, there's a 2-week wrap-up where we synthesize the topics that you've been covering over the 2 weeks. So 2 weeks for strategy, 2 weeks for people, 2 weeks for marketing, and then the 2-week wrap-up week where we focus on case studies and synthesizing. After those 4 blocks, there are 2 projects over the 2 years and those visits. So one project is the group project and one project is the independent project. So the health consulting project is your own independent project. So either you bring a project, for instance, I was talking to someone yesterday who wants to look at a mental health digital innovation startup that he would like to start up. So he kind of has his own project, but we need to work with him on the brief and deciding who he's going to present to at the end of his project, maybe a supplier, a potential buyer of his project. So I'll take questions in a minute, Asma, when we finish the slides. Or you can choose from a menu. For example, we're working with Qiagen. Qiagen has been working for a long time in Oman, and they have a very close government relationships on TB infection. So several students could work on their independent projects with Qiagen and be part of the company. But the whole point of the project is that you undertake an effective consultant project in the healthcare sector. You develop the appropriate research, project management, and consulting skills, and then you actually present according to client expectations as well as academic expectations. The other project is the group project that you do in the 2nd year. So working in a small group, you work again on a brief for an organization, but you do a joint report and a joint presentation. So it's a real world healthcare project challenge. Not only are we looking for academic credentials and experience, but we're looking for a particular mindset and approach. So we want people who are ambitious, but not just for themselves, but for organizations and eventually, obviously, health patient care and quality. And are willing to be flexible, obviously working and or doing other things while they're studying. So you may be a manager, never worked in the healthcare sector, or you may be fully immersed in the healthcare sector. You may be already a clinician. And you want to embrace the kinds of ambitions that we have for our students. At a practical level, admissions, there is an admissions website. You need a 2-1 UK minimum degree or equivalent overseas. If you don't have that, if you have extensive work experience with your qualifications, that will be considered. We need language IELTS, and this is a UCL requirement that we cannot waiver. You need 7 or above overall in your IELTS, and no sub area less than 6.5. Around a minimum of 5 years work experience and a well-balanced GMAT of around 600. but you can ask for a waiver for that. All candidates we interview for about 20 minutes on MS Teams, just to make sure, we are the right fit for you and you're the right fit for us. And we also take into account the kind of overall package of your personal statement and 2 references, one academic, one can be non-academic, but they need to come from a professional, ideally email address. This is the link for GMAT. You can take GMAT multiple times online and we record your highest score. At the interview, these are the questions we ask. So with my colleague, Dr. Pretty John, who is the Deputy Dean for the MBA Health programs, we ask about your career journey, your motivations, what makes you exceptional, what you can contribute to your cohort, your expectations, some idea that you've kind of got some appreciation of your strengths and weaknesses based on self-assessment and feedback from others, and where you might like to be when you graduate and beyond. So these are the scholarships that we've awarded this year that have finished and that we should be able to award in future years. So there's a Health Future Impact Leader Scholarship of up to £15,000. There's a Women Healthcare Leaders Scholarship for up to £5,000. And there's an East London Healthcare Leaders Scholarship, again of up to £5,000 for people who work or live in East London, which is where we're based in the Queen Elizabeth Olympic Park. And we have multiple scholarships, I know, for the Healthcare Impact Leaders Scholarships and for the Women Healthcare Leadership Scholarship. So you may apply for all of these and have different degrees of success. We also have a Roche Scholarship that we had this year, which is a full scholarship. And clearly there are lots of other scholarships around. So it's quite important. There are clearly loans. You can ask maybe for funding from your employer. So you could have a whole package. When I did my MBA, I managed to get scholarship from the central government in London, half from that and half from my employer. So be creative, and there's a UCL scholarships finder there. Be creative and see what's out there. And particularly as women are underrepresented in healthcare leadership positions, the scholarship I got was actually for women. And I was the first person in the organization I worked in ever to get any funding for an MBA. And I made a very strong case that it would benefit the organization. So we have, as I said, this onboarding program to help you get up to speed in areas maybe you've never studied before, depending on your background. We have a very strong induction. We have these various psychometric questionnaires and so on, and you do get personal tutoring and one-to-one support. And then there's lots of other things going on at UCL. For instance, in the Innovations and Enterprise Services, the UCL Careers Service is a very lively students' union with over 250 clubs. It also has careers advice and support for mental health and well-being and counselling, which is obviously really important if you're there was a report yesterday in the UK that 23% of students said they felt lonely and isolated during their studies. Clearly, obviously, the pandemic didn't help that. But we really want you to integrate and belong, even if you're not physically in London necessarily. There are support services that you can access. And London is a fabulous city. So when you do come to London for that week, the main base of UCL is in Bloomsbury, but we're also got this fantastic campus in UCL East in East London. There's lots of free events, tourist attractions, festivals, museums. It's a very green city. You can walk around London, going from park to park, pubs and clubs. And QS rankings last year ranked London as the top city for students. So it's a very attractive city for students, for faculty members and practitioners who we have on our team. And also, we have international people as well, very diverse group of people. So those of you particularly interested in scholarships and funding can join Professor Nora Colton on the 15th of June. She will be running that session online, or you can listen to the recording. You're also welcome. I have a panel session in person and online on the 28th of June, 6 o'clock to 8 o'clock. Very interesting entrepreneurs, clinicians, academics who are going to talk about innovations in the sector. And clearly we have more events happening in the next academic year that you can keep in touch with on Twitter, LinkedIn, and follow us. So that's our main website. Okay, and at any point, you're very welcome to email me or Dr. John about any question you would like us to answer. So let me just finish this, stop sharing, and then I'll now look in the chat box and Q&A for your questions. Okay, so for Asma, you asked, how can I be eligible for a full scholarship? So it'd be very useful for you to attend the 15th of June event or to look at that recording. So clearly in any scholarships, you have to be very careful about looking at the criteria, and in your point-by-point statement, you need to address every single criteria. So some may be discretionary, some may be essential. So clearly for the Roche Scholarship, you had to be UK based. So if you're not UK based, there's no point applying for that scholarship. Okay, and another question, where can I find the link for the recording of this webinar? It will be available after the session. We have a GBSH YouTube channel, and Adam Vidler and Sophie Elwin post up these recordings. So the online program is not on campus, apart from that 1 week in the first year. We have a fully in-person MBA, which you can do in 1 year, same price, or in 2 years, part-time. And for the full MBA program, it is delivered 1 o'clock to 6 o'clock in the afternoons in the teaching blocks. And we also have 2 weeks in the January of the first year, either of the part-time or second year of the full-time, sorry, or second year of the part-time. 2 weeks in Riyadh, I'll be leading on that. 2 weeks or 2 weeks in Lagos, Professor Colton is leading on that, or 2 weeks in India, where you do your group project. So you can join us on campus full time, or you can decide to do the EMBA Health online. So yeah, we'll make sure that's clarified. So if you're an overseas student, you don't have to travel to UCL to do the EMBA, but you do have to travel to UCL to do the MBA Health. So the MBA Health, as I said, closes on the 30th of June. So if you do want to start in September, you need to make sure you at least get your application in by the end of this month, and then we could interview you a bit later if necessary. If you studied in the UK in English, that still doesn't count, unfortunately, for UCL. This is a top university. We need proof of your IELTS. So you can take it online, but you do need IELTS taken in the last 2 years, and you do need it at level 7. So never mind if you did your A levels here, or you did your first degree in the UK, that still doesn't count. We still need proof of your English currently. So Asma, please do go to Nora Colton's session, because she will talk about building your case for a full scholarship. And if you do come to the UK for the full MBA, as an overseas student, you are allowed to work for 20 hours. So you can do voluntary work, but you also could do paid work. So we do have a shortage of workers after Brexit, so there are opportunities. And in QE Park, there is the biggest shopping centre in Europe. So if you wanted to work in retail or things unconnected to health, you could still, earn money here to supplement your living. Okay, so I think I've answered all the scholarship questions that Asma was asking me there. So I hope that's been helpful. There are other people here. Mali, for instance, do you have a question? Feel free to ask any other questions. You're very welcome. I will allow you to talk as well. So I've unmuted you, so you can.
Hi.
Hi there, go ahead.
Yes, I have no question at the moment, but I'll come back. I got your email address. I'm working actually at UCL. I'm basic researcher, research fellow.
Oh, great.
So yeah, I will think more and then come back to you.
You're already at UCL. Yeah. We do have 2 people connected to UCL actually. One of whom is, she's just got a big research grant. She's a research manager, and she went to Harvard for social science, and she's from Africa, but she's decided now to do it part-time, the degree, so she can kind of continue with her research project and other things the other half of the time. So we are flexible where we can be.
Okay, yeah, thanks. Yeah, thanks to know. Yeah, thank you very much. It was good. Yeah.
And we can put you in touch with other people if you want to chat. Yeah, and if you are successful, what we've done with the MBA, we have a kind of LinkedIn special group of offer holders. Okay. And every month at the moment, we're having kind of get-togethers. So if people want to, they're starting to get to know each other, which is good. Because obviously it's kind of co-production. You're obviously very intelligent, capable people. So and it's going to be not a huge cohort. So we want to design these programs with your interests in mind. Okay,
that's good to know. Yeah, I'll join to the group, LinkedIn. Yeah.
Yeah, so we do that when we offer people. So if you were successful at interview, we have a WhatsApp group and we have a LinkedIn group where you can, start to talk to other people. Okay.
Thank you.
So Asma, you still have your hand up, but I think maybe I've answered your questions, perhaps about scholarships. I haven't given you one, unfortunately. I would love to give you one, but there are procedures and they are very competitive. So it's good to go to Professor Colton's session. And like all kind of writing, you don't just write it once, but you edit, ask people for advice, get people's feedback on your scholarship application. So people are normally quite generous in helping with advice, I think. Okay, well, if that's everything for today, thank you very much for your time, your attention. I hope that's been useful. Do keep in touch if you aren't necessarily ready to join the MBA and decide by the end of June. You have quite a long time still to apply for the EMBA in health. So we're very friendly, welcoming kind of institution, UCL. So feel free to get in touch with us anytime and we can have a quick MS Teams call or reply by email. So enjoy your weekends and good luck with your plans, everyone. Thank you.
Thank you. Thank you. Bye.
Bye now.